learning experience for all of us as we interview the author. So,
Yeah.
Jon Anders, let us know, kick us off with why you wrote this book.
Yeah. Um, when I started learning ISTDP, I came from the psychodynamic world. Um, and I was on the search. I worked at this outpatient clinic in the public healthcare system here in Norway, and I was looking for a short-term approach. And I somehow accidentally came over ISTDP. It was started to grow in Norway. Um, And I started learning ISTDP, and I found that a struggle. I really struggled when I was learning ISTDP. I struggled to integrate my previous knowledge from doing psychodynamics therapy, from doing mentalization-based therapy. Um, I was feeling quite confident as a therapist when I started learning this, and suddenly I had misalliances. I I suddenly found myself not knowing what I was doing. I was doing a lot, but I didn't know what to do. And when I started reading the books, I sort of realized that I lacked the understanding of why am I doing what I'm doing? What am I actually trying to achieve here? Uh, and I think I went through whole core training feeling like this, that I learned a lot. I learned a lot of techniques and learned a lot of new terms, and I was really inspired, but I somehow lacked a coherent view of what I was doing. I don't think it was until I met Patricia Coughlin. I think that was in my third year in core training, and I reached out to her to have supervision, and I've had supervision and advanced training and teacher training with her in, I guess it's 10 years now, almost at least. Um, so I really struggled to understand the basics. I didn't find a book that could teach me the basics. And it took me a while to understand that I could integrate my previous knowledge from psychodynamic therapy and do alliance-based ISTDP. I think that came from Patricia. So one of the main inspirations from writing this book came from my own process of learning ISTDP, realizing what I didn't understood, gradually getting it from Patricia, and feeling the urge to like summarize what I've learned so far, uh, and somehow bring further these things that I found important. These three parts. That's the structure of the book. First part with the psychodynamic understanding, the second part, which was maybe my main inspiration by writing the part about the conscious alliance, because I couldn't find anything about the um, conscious alliance in the literature, uh, but also trying to integrate the technique, of course. Um, So I think that was the main, might not, maybe not the main inspiration, but one of the most important inspirations. The second one came from working with students. And I know that some of you are here attending today. I'm really pleased to see you here. I work at the university here in Trondheim at the clinical master's program, where this is how we um, make psychologists here in Norway through this clinical master program. And in their fifth year, they have their first patients. So I'm sitting behind a one-way mirror with three of their co-students and watching as they have their first therapy ever in a 14-week program where they have a patient that they follow through these 14 weeks, and I'm supervising them and trying to teach them how to do psychodynamic therapy and ISTDP. And so this is also, and also I have these lectures about ISTDP and psychodynamic therapy. And this is also the result after 10 years of teaching there. This is somehow a summary of what I see that my students have needed to understand and start to being able to do ISTDP with patients, even though they don't have that much previous knowledge. They need to understand the basic of psychodynamic theory about transference, about conflict, teach the two triangles, and the conscious alliance, agreement on task and goal, and within a relationship with a good bond. So I think those two are the main inspirations. My own learning curve. What was important for me to develop as an ISTDP therapist, have good alliances and good projects with my patients, and also my experience of learning, or not learning, of teaching. And I
Yeah.
also think that there is a third one that also inspired me. It was, I guess a lot of you have heard about it. There was a couple of years ago, there was a big debate in Norway uh,
Hmm.
after a psychologist who had been a patient in an ISTDP therapy wrote an article in the journal, the Norwegian journal, with a warning saying, hello there, this ISTDP therapy creates misalliances. I had one and I've heard about others. And
Hmm.
it created a big debate on Facebook and in the journal about what kind of therapy ISTDP was. And I think that the ISTDP that was portrayed in that debate wasn't the ISTDP that I had at my heart. The way I'd been taught ISTDP was a therapy of curiosity, of emotional closeness, of alliance and complexity,
Hmm.
helping people contain their complexity. And this that was portrayed in these articles was more like a cold, all-knowing, uh, misalliance-based therapy. So I also think that one of my main intention, maybe semi-conscious, was to write an answer to this, the way that ICB was portrayed, because I wanted to show that it could be done with warmth and with a heart in it.
Hmm.
So,
Yeah.
so that's the whys.
I love your whys. Yeah.
There is
Go
a
ahead. Yeah, there's hand raised. Talia? Or Tanya? Tanya.
Tanya, sorry.
Sorry,
Is it
Tanya.
okay to ask questions now?
Absolutely. Yes, we
please.
welcome them. Thanks for starting
I
us
was,
off.
thank you, Jon, for your book and everything. I was just curious in terms of if there is a specific population you've been working with when you started your journey with ISDP.
Yeah. Um, I came from the public healthcare system. So my first years, when I did core, I worked in an outpatient clinic in the mental health system. I guess it's 80% personality disorders. I had experience from working with borderline personality disorders. But after a few years, I changed the place where I work to where I work today. And 4 days a week, I work at this student health care center. So I work on a quite healthy population now. Um, and I think I can ask you afterwards why you asked that question. I have a theory. Uh, but I think I've been working with both severely severe people with a lot of problems with personality disorders. But now I work with functioning students, but with sometimes pretty high levels of symptoms. But yeah, my main experience is from the resistant specter, uh, and I don't write that much about fragility and the more severe specters in my book. And partly that's also a conscious choice because I think it's important to understand these basics before going for the more advanced.
Yes.
Can I ask you, Tanya, why did you ask that question?
Just curious. I'm starting reading your book and I was just curious.
Yeah, because I think
Yeah.
it shines through in the examples, at least, that this isn't the most severely ill patients. Um, yeah. Thank you for your question, Tanya.
Yeah. Go ahead, Max.
Thank you. I haven't read the book yet, but I look forward to getting it. And thank you for having this presentation. So I suppose you mentioned the article in the journal about the misalliance.
Uh-huh.
And you also said while you were learning ISTD at the beginning, you noticed you were having more misalliances.
Yeah.
And I was just interested on your thoughts about, why that was for you, for example, and I mean, I can definitely relate to that.
Yeah.
So was just wondering, your thoughts about it.
Yeah. I I think that it's a part of learning something new. Always before you get better at something, you have a dip when you're trying to learn something new. So that's a part of the process as well. But when I starting having less misalliances was when I started working more structurally on the conscious alliance, taking
Mm-hmm.
time to do inquiry, asking my patients what's their presenting problem, what they're here for, asking for how more details on the symptoms. When did they start? Have you tried to handle these symptoms? What is your understanding of it so far? Uh, Getting into specific examples, not for treatment, but for inquiry, to get an overview of the defense mechanisms and have a shared view on the defense mechanisms and trying to help the patient turn on them. And somehow, through that, get an agreement on the task that we're here to turn on the defenses and regulate anxiety and experience feelings so that we can get to the bottom. And I spent much more time on that in the start of the therapy so that the agreement was clear, so that my patients, when they come in, they know that they're here. At least they should have the, not every time, but then we'll work on it. But my goal is that everyone should enter the therapy with a sense of, I'm here to experience my feelings because my defenses are hurting me or my unregulated anxiety is hurting me. And I need to try to understand what that comes from as well. And when I started taking some time doing that, my degree of misalliances um, was decreasing. And even though I tried for a portrayal, or I tried for a head-on collision, and I tried, then I could, when the alliance was there, even though I failed, the patient knew what I was somehow trying to achieve. Uh, and because when I look back, I think I tried to do ISTDP on patients that hadn't got a clue what feelings had to do with it all.
Right.
So me listening to just the unconscious signals didn't work for me. I had to go through the conscious processes.
Yeah, that's such a great answer. And if I may ask one more question,
Please.
like, because that's exactly my experience, and I'm wondering sometimes if somehow when we start training in ISTDP, and maybe we can talk about the reason for it, is sometimes we throw away those basics of basic therapy and just start doing ISTDP.
Yeah.
And I guess I'm wondering like why we do that and why it isn't more emphasized, like, keep doing what you're doing, I
Mhm.
suppose, in a way, basic therapy, and then add in stuff. Because I think,
Yeah.
I just had the same problem where I just threw myself in and started doing ISTDP and had problems. So
Yeah.
I appreciate your answer, and I'm just wondering if you or anyone else has thoughts on that. I don't want to.
Yeah. That's a good question because I think it's important to acknowledge that ISTDP is a therapy. We should adhere to the common factors. I think it's Patricia Coughlin who says ISTDP is a therapy where we should highlight the specific factors in an environment bathing in the common factors.
Mm.
Uh,
Wow, that's so great. Thank you. Yeah. Yeah.
we need to do both.
Yeah. I just want to say, piggyback on what your question is, Max. It's such a good one because how many of us in this room have struggled with misalliances at times? Yeah. So it's a great question that you're bringing forward. And one thing that I love your answers, Jon Anders. And one thing that, for those of you that have not yet read the book and are obviously drawn to this or are in the book, one thing that I so deeply appreciate is exactly what you're saying, Jon Anders, is like getting so crystal clear with the patient, working on the conscious therapeutic alliance and getting that so resonant and coherent as possible with the patient. Like, why are we fishing for feelings? What is that about? And when the conscious therapeutic alliance can be grounded and anchored, then the patient is, their will is more on board, they're willing to look at, they're understanding their symptoms are leading to their avoidances, right? And I think the why, like why do we throw that out the window at times, Max, and just, do ISTDP? It's like, how do we integrate the conscious therapeutic alliance and really getting clear for ourselves and for them at the task at hand? So therapy makes sense, right? And then when it makes sense, there's going to be a groundedness of alliance between us and our patients. And I think, Jon Anders, you do such a beautiful job of like coming back to Davinlu's earlier work, which Patricia, teaches more the earlier work of Davinlu. And then there's some teachers that, teach more from his, the evolution of ISTP, his later work on more mobilizing the unconscious. So it's kind of like, how do we integrate, how do we hold complexity of, as learners and teachers and therapists, of holding, the basics along with, mobilizing something in the room, but first really getting clear about what we're doing and the why.
Yeah.
And you do that so beautifully, Jon Anders, in
Thank
your
you.
book.
And I think
Yeah.
this is an important thing as well to know. Was partly the intention and one of the topics on the panel that we had in Venice in the big conference in 2023. You and me, Tami. I think it's important to recognize that Devon Liu changed a lot over time. And
Yes.
I came from a psychodynamic, psychoanalytic background, and I was drawn to the early writings, and I've always been drawn to the early writings of Devon Liu, where he's talking about getting to the bottom of the conflicts. He's talking about the Oedipal conflicts. He's talking about pathological grief. He's talking about these psychoanalytic concepts. So he's trying to do get to the result of the psychoanalysis where the unconscious is open. And I also been training with Patricia, and I was drawn to her because of that. But she's also trained with Devon Liu in these early days.
Yeah.
And as I see it, my interpretation of the field now is when people have been training with Devon Liu is quite influential on how they understand and how they teach ISTDP. And I think this is important when we're learning ISTDP and teaching ISTDP because we present ISTDP in different ways. And that can be quite confusing when we're learning. Hey, that was serious talking here. So I think that's an important point, and it's because that's confusing. People say different things.
Yeah. Yeah. Anne, welcome.
Hi, thank you. So I have a comment and a question. First, I just wanted to say I've been a therapist for 4 years,
Mhm.
and I have really, really focused on ISTDP for 3.5.
Uh-huh.
And two of the people who have been most influential on me are here, Deb Pollock and Tami Chelew. So thank you.
Mhm.
The comment is I'm a late career changer. So I've felt the beauty about being older is that you see life with a little more urgency. I don't have years to learn to become a really good therapist. So I have really focused on learning. I spent those 3.5 years spending a lot of money and really focused on learning. So my comment is just, with all that, it's been really challenging to take all the different perspectives, the John Frederickson, the Alan Abbas, the Tammy, the Deb, all the different, and integrate them and figure out how to learn this. And I found, from that perspective, I found your book extraordinarily helpful. So
Oh, I'm
that's
so
my
glad. Thank you.
comment. My question is, I had a totally different career before this. And a lot of people come to ISTDP having been psychodynamic psychotherapists.
Yeah.
So I as a new learner, I was also trying to catch up on psychodynamic
Mm-hmm.
psychotherapy theory.
Mm-hmm.
Obviously, that's a huge, huge, huge challenge. I'm curious from your perspective with all the people that you've taught, what you've seen is the difference between people who come to ISTDP as a fresh therapist and people who come to it who've already been a therapist.
Mm-hmm.
If you have an opinion,
Ah,
thoughts on that.
my first thought is that everyone struggles. It's a difficult method to learn. And one of the things that everyone says, it's hard to integrate John Fredrickson, Patricia Coughlin, Al Nabas, and because they have these slightly different takes on the same things, and that's confusing. I have mostly been teaching students and new therapists. I haven't worked with that many, like I haven't supervised that many experienced therapists, but I have colleagues who's learned it in a later year. Uh, and I think we struggle with mostly the same things.
Mm-hmm.
Uh, I don't believe that there is this big difference. But what I can say is that when I teach the new students that comes in without any previous knowledge on therapy, what I'm trying, what to take them from step 1 to 2, or like from ICD 1.0 to 2.0, it's understanding the two triangles and some basic psychodynamic concepts. When they understand that because of childhood experiences, together, of course, with biology and stuff, but because of childhood experiences, the people create inner conflicts. They will have certain themes and certain feelings and certain conflicts that are difficult for them to cope with. And there will be a lot of feelings attached to that. And those feelings create anxiety. And because this is difficult, you will have to use defenses. And because of these defenses have consequences, and unregulated anxiety have consequences. And when my students start seeing that because of these conflicting feelings that evokes anxiety, they use defenses, and then they suddenly realize these are the very mechanisms that creates the presenting problems.
Yeah.
When they understand this, they can start to improvise. So I try to withhold technique and draw a lot of triangles. Ask any of my students, they will say, "Oh, he's going to draw triangles again." I'm drawing a lot of triangles to help them separate the corners and understand what's on each corner. And then suddenly they start to improvise and can become really, really good therapists. And it's like once in my life, in an earlier life, I dreamt of becoming a jazz musician. And for every one of you who knows jazz, you know there is a lot of highly technical, skilled jazz musicians. And there are a lot of those that's not that technically skilled, but still all the same creates fantastic music. And I'm drawn to the latter type of jazz. I'm not into this quick technical jazz. If you understand music, if you understand the conflict, if you understand the triangles, you can start creating music with the patient. You can, and if you also have like this conscious alliance, the patient will start doing some of the work themselves. Right. So that's partly an answer to your question.
Yeah, I love what you're saying, Jon Anders, and answering Anne, and taking your time on really helping the patient understand their two triangles over and over and separating the corners of the triangle. I mean, none of us, at least, well, I'll speak for I was not, I didn't learn this growing up. Oh, myself, feelings make me anxious and I use defenses, and it happens in the past, present, and in the therapy room. So it's almost like I love like the slowness. And Patricia says you go slow in the beginning and then you can go fast in the end. So it's like going slow over and over of these triangles. And some of us I'll speak for myself, need it over and over because it's so syntonic. It's so out of our awareness, right? It's so not not even not out of it's out of our awareness, right? These unconscious dynamics, and to make them more conscious, you're letting us know you use these triangles to bring more consciousness to the patient, and that's going to develop this beautiful conscious therapeutic alliance. And the other point that I want to say is, in Davinlou's central dynamic sequence, a huge piece of the change, to include primary change and secondary order change, is for the patient to be acquainted with their defenses, see their defenses, feel the pain of the cost of those defenses, the function of them, and to turn on them. Not us writing, pulling them to turn on them, but for them to make sovereign choice if they wish to turn on their defenses. And only then really do we have, in a way, a patient on board that says yes, and be the driver of their own therapy, be the engine of their own therapy when they get acquainted with the triangles of their personal psychodynamics.
Yeah.
So the turning on defenses is such a key point that I think gets missed, and that I miss, so it's like coming back to the basics.
Yeah. And I think that a lot of people coming in for supervision say, I'm not able to break down my patient's defenses, or I'm not able to make them put them away. And I think that's, and maybe especially young men actually, talking about breaking down the patient's defenses instead of realizing that we can't break down anything. We can't turn anyone. We could help them identify and see cost and consequences, and help them see the defenses functioning, that they're keeping feelings away. And when they see that, they can make a choice if they're willing and have the courage to start facing their true feelings.
Yeah. Beautiful.
Yeah.
Andrew.
Thank you so much for your book. I've read all of the major books by Abbas and Fredrickson and Cochrane, and I thought, am I going to learn anything from this? And I did, and I found it really valuable. But one of the things that struck me was that the first section of it is actually applicable to anybody, not just therapists. And I thought, let's try this as an experiment. I have a friend who's an accountant, and she has a network of friends who, a lot of them have suffered trauma, and she's often asking me about her conversations. And so I said, here, read this book, just read part 1 and see how it works for you. And she is so excited about the insights it's giving her. And I'm thinking, everybody should know this stuff. Like, we all have people who have any kind of issues in their life, and to understand transference, you see, oh, it's not me. This stuff I'm getting is not actually me. It's what's happened being transferred onto me. It's just so important. So I wonder if you thought about writing anything for a wider population, because there's a big gap there.
Oh, that's first of all, thank you a lot for saying this, for telling me. That's really encouraging, and it really makes my heart warm to hear that it can be applied that way. I loved to write the book, and it had been growing inside of me for like at least 5 years. And when I had the fortune to have 4 weeks of sabbatical, 4 months of sabbatical, it was an experience of flow. I really loved writing it. So I'm looking forward to the next time I have a book inside of me. So I'm playing in my mind with different kinds of books, and I've been wondering how could this be transferred, I don't know if that's a proper English word, to the wider community. Is it through storytelling? Should I tell more patient story and try to how I understand them? Is it through like bringing the theory out? I don't know. It's so interesting to hear that this was, and it's quite funny that you say it was to an accountant. That talks to my prejudices and and the awareness of feelings.
Yeah, she's Nigerian, and her background, a lot of people have had some trauma.
Yeah,
But I think you have a gift of making things simple
yeah,
that are complex, just the way you lay them out, and also interweaving it with an actual transcripts of your conversations is really helpful. So
well,
that combination of things, the only thing she struggled with, a few places, some technical psychological words she didn't understand, but that's the feedback I've got from her. Apart from that, it's been very, very, it's like lights going on in her mind.
oh, thank you, thank you. I would really, I'm going to take that with me, and I will keep it spinning in my head if that's something I could do. Thank you.
I love that, Andrew. Like a farther reach, Jon Anders, not
Yeah.
just psychologically minded people, but a farther reach to the masses of yeah, these concepts that are so deeply freeing for people to better
Mm,
understand
mhm,
themselves.
mhm, mhm. All right.
Yeah.
Yeah.
And just anything that has been shared, so far, questions, even on kind of the evolution of ISTDP and how we can improvise the differences. And obviously I don't live in Norway, and I know there was the article and what you mentioned, Jon Anders, and there's a lot of folks here in Norway that probably have come from understanding that kind of debate and so forth and struggle of the misalliances. Is there more that you'd like to share on just the evolution of ISTP, and
Mm,
also inviting those of you that may have further questions or deepening or even reflections or statements, like how can we as a community, you know, improvise? How can we integrate? What does that look like for us as we continue to grow and deepen?
mm.
And so next up, Deb, the future next IEDTA president. Let's hear from you.
Oy vey. I
What
just,
thoughts do you have for us, Deb?
well, I am gonna plug the conference in a minute. I have a
Good.
connection, but
Okay,
not to
good.
take the attention away from Jon Anders and his awesome contribution. But just I wanted to like piggyback on what you said and what Jon Anders said about improvisation. Because I was so thrilled to hear how much you use that in your teaching and supervising, Jon Anders, because I think we need more of that. I think that there's not to throw anyone in particular under the bus or anything like that, and we all have weak spots in our teaching and supervision. But I think in ISTDP, I've noticed sort of a tradition in the teaching of like repeat after me, or this is how I say it, and then and people tend to sort of imitate what they're hearing. And then what I find often is that, like with my students and people I work with or supervise, that's where they get into trouble, is because they're trying to imitate, what John Fredrickson said or what Alan Abbas says or whoever. And oftentimes it's not because those teachers told them to. It might be because they're reading Co-Creating Change and they're like, wow, that sounds amazing. I want to be able to do that.
Mhm,
And so they imitate it. And I think that's one of the earliest ways that we learn also. I mean,
mhm,
that's how
mhm.
kids learn to do things. And so it makes sense. But I think as teachers and supervisors, it's really important for us to help students move past the imitation phase and then find their own voice within this. And
Yes.
so, I'd love to, this is my plug for the conference. I'd love to hear more about, if you happen to be planning on presenting at our next conference, which we're
Mhm.
about to get the call for proposals out. So it would be good for you to think about this, since we'll be a little bit closer to you this time. Um, like if we could hear more from you, not necessarily today, but like at the conference or some future venue, about how you do foster that improvisation and helping students get more confidence in their own voice, and how to like just, okay, these are the principles, but how do I make it my own?
Yeah. Yeah. I would love to say more about that. And I will attend the conference in Croatia in next October. I really recommend these IEDTA conferences. It's a great meeting place to meet colleagues, and also it's also always both in Venice and in San Diego, which I attended, was great experiences, both professionally and personally as well. I can say a little bit about it. I think when I start to do introduction of ISTDP to students, I believe there are some of my students here. I would love to hear their comments on it if they're dare to do that. I try to start like a bottom up, understand the basics, to understand the symptoms and the presenting problem through the two triangles, and do take time for inquiry and take time to get a shared understanding of which kind of mechanisms is creating their symptoms, to like get an agreement if there is a defense mechanism that's what's creating the symptoms, and also understand that that's a way of avoiding. Because when both the therapist and that students in this case understands this, and also the patient together with the student understand this, that couple can create a lot of change just through that understanding, because they will start, so let's try to figure out what we can do then to experience these feelings. And it's not that I teach technique as well. And I think technique is important. But I never start with role plays. I don't think I do role plays until quite a lot of meetings. I guess we don't do role plays until session 4, 5, 6. And sometimes I don't do role plays at all. And I don't do skill trainings. Almost never. Sometimes I do, but that's secondary to the understanding. Because I have this sense of when I've been doing more of that, the techniques come out at wrong places. They start trusting the technique instead of their understanding and their cooperation, at least at an early phase. So the therapies end up better when they start from their understanding and their shared understanding.
Yeah.
That's what I mean about improvisation. And then I can, or maybe you should ask, what's the feeling towards him instead of what are you feeling right now, to get some specificity. And I teach defense work with, try to help them identify the defenses and the cost and the consequence and also the function. I try to teach those 1, 2, 3s. Some of my student calls it the 1, 2, 3s. And you can do that with more healthy patients at least. And also what I was thinking about, how I understand the evolution of ISTDP is that it comes from psychoanalysis. Devon Lew was a psychoanalyst, and the first, of course, there was only psychoanalysis back then, almost. And he was teaching ISTDP to psychoanalysts. And I guess that wasn't too easy, but they were well trained in theory, and they had this deeper sense of understanding. Even Aaron Beck, the founder of cognitive therapy, was a psychoanalyst, and he had been working with this, trying to understand a lot, and he had a lot of theory. And both Devon Lew and Aaron Beck said, we need more technique. We need to focus, and we need to be more active, and we can help people faster in that way. So they added technique on and helped people with a lot of theoretical knowledge to gain some technique, and I think that was very helpful. But we're risking to do the opposite now when we start training people to do technique without teaching the theory. Earlier in the 50s, maybe we had highly skilled theoretical therapists without technique, and now we have highly technically skilled therapists without theory or a deeper understanding of the human psyche. Of course, this is a little bit black and white. I understand that, but that, I think it has to work together. Theory and technique has to work together, and you have to understand before you start to act. It's like the music theory, music analogy again. If you don't understand music, if you have no clue where you are in the progression of the song, and just doing techniques, it's not music, it's technique.
Yeah,
Um,
it's kind of like what you're saying on Anders is like understanding more clearly for ourselves the why. As
mm,
we're grounded more deepened into theory, we can better understand the why of our interventions and these techniques, right? And yeah,
yeah.
that's really important. Uh, Go ahead. I see your hand. I don't know how to pronounce your name.
It's Ingeborg.
Okay,
Hi,
Yeah.
welcome.
hi, Ingeborg.
Hi. I think it's a little scary to kind of speak out loud, but I thought I had
We love
to
it.
present because I was Jon Anders' student, because I am a psychology student at the university, and just wanted to comment on the fact that you focused so much on teaching the theory before the kind of specificities in the technique, because I think it's really important in terms of finding your own kind of voice and like therapeutic style. You allow so much freedom, and I think the way that you taught it, it made it look and like feel a lot easier than I have realized it is, because I was so inspired, so I wanted to learn more, and then I thought by reading all the other stuff, like, wow, this is actually really hard, but you've made it kind of feel like it was possible, and it was so fun, and I think it was so important as well because the interpretation I had was just based on the debate in and the articles that viewed it so negatively. So I think it's a really, really breath of fresh air, and your kind of passion, it really makes us students feel very engaged as well. So thank you for that.
Oh, thank you, Ingeborg. So, and this is for to all of you. She did a great job. She did an amazing job in these 14 weeks of doing ISTDP for the first time. Had a great result. There's a lot of honors to you, Ingeborg, and really proud of you to speak up today.
Yes. It's so nice to kind of hear the proof from the pudding, right? Your student, right, of like
Mhm.
what they're learning and growing and so deeply appreciate from you, Jon Anders, and what you're contributing to our field. Um, is there any other kind of last questions or comments from you, Jon Anders? Any questions that haven't been asked yet that you would like to shed light on before we take our 15-minute break?
Um, I'm not sure. I'm really, really glad to hear this feedback that it somehow connect the dots. And I think that was my major aim in writing this book, to connect some dots that I had been able to connect and that I had been struggling to connect. Because I thought there was lacking an introductory book.
Yeah.
And I also had the experience that when I was introducing these students to more like classic analytic work, they were somehow alienated. They didn't. It felt strange. The wording is strange, and um, so I really hoped to inspire some more reading and like form a foundation to read upon. And if some of you have felt that I've been able to do that, I really, really appreciate that.
Yeah.
Um, yeah.
Yeah. I think we are letting you know that and that you're getting that great message from us. And I'm just looking at your book, like the
Yeah.
cover,
Yeah.
this blank map, like, what the heck do I do? And, your book, yeah, really leads us in a way that I think you're letting us know, yeah, that other books, other authors, maybe. And again, this is coming from your own growing pains and learning
Mm.
pains, Jon Anders, right? Like what does this all mean? And I really appreciate, like, for those of us on this call that aren't steeped in psychoanalytic background or psychodynamic, which would be me, it's very wonderful to just to kind of have you ground that in and anchor it in, because I think what you're saying, like when the theory is more solid for the reader and for us as clinicians, right? Then we can branch out and apply techniques and timing and really getting a sense of response to intervention. And also to say that mistakes, one thing that I do really appreciate about Jon Fredrickson is we're all mistake makers, right? Misalliances are going to happen, but it's kind of like, what can I learn from this misalliance, right? What guidance can I get for myself to teach me of, maybe I didn't have such a strong of the triangles really cleared out for us both, right? Like whatever that is. So I think misalliances aren't always huge failures. It's also lessons of like, okay, what did go off, and how can I continue to get back on the map and the path. Go ahead, Alba.
Yeah, hi, Ayla from Finland. Hi, Tami. And everyone
Hello.
else. And thank you, Jon Anders. Just a quick comment. We have a rather new community here in Finland, and we're basically all, so far, we're psychoanalysts or dynamic therapists that are bringing in the ISTDP, and we're training with Sharon Louise from London and Rob Naborsky with the attachment approach. And I think this alliance-based idea that you introduced it has such a similar flavor, like absolutely. So it's really nice to hear you approach it this way. I don't know if my colleagues that are here feel the same way, but to me, really, it makes so much sense to approach this. And I think this kind of is the way we've been taught, maybe a little bit different flavor, but the general approach to working together.
Yeah. I'm glad to hear, and of course we have to work together. It's like, let's do joint forces to like try to solve the patient's problems, and like bring in all of the resources from the patient and all the resources from the therapist. That's how we make the best therapy. So, but it's easy. We're mistake makers. There will be misalliances, and it's always a misalliance isn't a problem as long as you're not trying to solve it, or you have to be willing to listen for it. You have to be willing to find another approach. And it's surprising, or maybe it's not surprising, that a lot of times with the when I get supervision, still with Patricia, we end up talking about the basics. It seems like we've lost the agreement on the task here, or the patient is still not turned on the defenses, or is it clear? Are they really? Or do you have a shared process of coming to the bottom of the conflict? Very often we're back to the basics after 10 years. And I think that's how it is. That's where we get lost a lot of times. Or something like just the other week, I had supervision with some peers at work. I had 10 sessions. There were no change. I used this OQ45, and there was no change, and the patient was getting frustrated. And we started talking about it, and I thought after the session, what am I going to do differently? I have no idea what to do differently. And I had been doing the same thing for 10 weeks, and it hadn't been working. And then I got supervision, and of course I had blind spots. This patient was doing something after she went out of the room, that she was somehow obsessing on the therapy, and she was doing things that wasn't helpful for her after a session, not during session, but afterwards. And just by having some people supervise me, you have to ask this woman what she's doing after the therapy. Why is it going wrong? And then she had a lot of relief afterwards and came back the next session saying, I'm feeling so much better now. And we need supervision. We all do mistakes. We just need to like open up and get supervision. And I had been hesitating getting supervision on this case because I was sure I was doing everything right. Of course, that's not the way of doing things. Knut.
Yeah, I mostly just wanted to say thank you, Jon, for the book. I thanked you before digitally, but I wanted to do it at least on camera. My only complaint about the book remains that it didn't come out earlier. Um,
Sorry about that.
and just a reflection on a thought that popped up before you said what you said as well. I mean, we talk about these things as kind of basics and fundamentals, but I think at the same time, they're more than that. And that's part of what I really enjoyed about the book. It was a chance to go back to the fundamentals, which the good fundamentals carry so much also later on. And that's why they're worth coming back to. It isn't, the basics aren't just the basics, I guess what I'm trying to say. Because there's always more there. These triangles are so simple, but then a couple of years later you see, oh, there's still more there to be learned. And your book was really good for that. Thank you.
Thank you. Thank you, Knut.
Beautiful. Well, great. This is perfect. We are at the 15-minute mark. So let me make sure I write that down. There we go. Somehow, I'm in a different chat. Sorry, guys. Okay, 15-minute break, and just stay on the call, and you can keep yourself unmuted and turn off your video, and we'll be back for didactic teaching and seeing Jon Anders' clinical material, and of course continuing this collaborative conversation. So thank you all, and we'll see you in 15 minutes. Bye-bye.
And one thing, for those of you who hadn't written in the chat where you're from, please let us know where you're from. It's so nice to see where you're all from, that we're here from all over Europe and all over the States. So,
Yes, all over the
see you in
world.
15.
Okay.
Yeah.
Enjoy. See you guys soon.
So my goal is to try to create this equal partnership with the patient as a co-therapist. We've been talking about it, that it's not about breaking down the defenses, it's helping the patients turning on the defenses, helping them to be acquainted with the defenses and then turning on them, trying to put them away. And I think this case that I'm going to show somehow highlights that, even though it's quite interesting that I skip a bit of the inquiry. I skip more of the inquiry in this case than I usually do. And we can talk about that, what's going on in me that's making me do that. But I think it highlights how this young man that we're going to see is turning on his defenses. I think this comic illustrates a lot what we've been talking about. This is the doctor and a patient, and the patient is coming to the doctor because her arm had fallen off. That sounds pretty painful. And then the doctor says, let's get you on a diet. I bet this doctor is good at diets. But that's not, they don't have a shared goal yet. Your weight is the issue here. How many times a day do you eat fast food? I'm here about my arm. And then we end up doing making a journal saying that the patient wasn't cooperative. And I think this, sadly enough, this happens all the time. That when our patient doesn't agree or understand or comply to our therapeutic project, we end up, at least if we have a busy schedule or in a pressure from the system, we talk about uncooperative patients not available for therapy, treatment resistant, and all of these words that can be used as some talking down to the patient somehow. So let's try to get these shared projects. That's my goal. But let me just say quickly what I've already been saying, that I think ISTDP is a psychodynamic therapy in the tradition after Freud and everyone that's come afterwards. It's based on the theory on conscious conflicts that will create symptoms. Davlu came in with his active defense work, studying feelings, studying videotapes, his pathways of anxiety, and how deeply experiencing feelings was an opener to the unconscious. a great contribution. And I also think it's important to highlight Mallon, who co-wrote. He was the ghostwriter and or co-writer of the Devon Lewis major work on Unlocking the Unconscious, the Yellow Book, which is a book that I've been really appreciating. That's Devon Lewis writing, and the way I've understood these stories is that Devon Lew really helped Devon Lew to get a theoretical framework on his brilliant intuitiveness. But their cooperation was, at least for the first 10, 15 years of ISTDP, it's really important. He's had a huge contribution, David Mallon. So I think to me, he's an important part of what ISTDP is.
Absolutely.
But it's psychodynamic, and it's defense work, and it's understanding the unconscious. And this we've been talking about, the two triangles, the triangle of conflict and the triangle of person. And it took me many years of learning ISTDP before I really understood how important this is. I think that I just understood this. I didn't understand that the symptoms comes out of the defenses and the anxiety. And it's a breakthrough in every therapy when you say, do you notice that the way you avoid your feelings, that is how you also create your symptoms? And when that happens in the therapy, when someone experience their symptoms in the therapy room, and you can say, now we're able to create them together, we're onto something here. This is important because this is what you do that creates your symptoms. Let's try to help you not create your symptoms. And also that there's at each corner of the triangle of person, there is a triangle of conflict. That the triangle of conflict that was developed in the past repeats itself in the current and with the therapist. This is the basic of ISTDP, and this is what I try to really teach when I try to teach new learners how to do ISTDP. This is the solution, as easy or as complicated as it is. A lot of people struggle with this as well. But if I'm not going to do something, if I'm not going to act or say something, or what should I do then? The solution is somehow to just let yourself experience feelings. If you're able to experience feelings without anxiety, you don't need defenses, and then there will be no symptoms. And when you understand this, you can start improvising ISTDP. There is also an importance, a big relief for me when learning ISTDP was when I understood that I didn't have to break down the patient's defenses. I could help them turn on them. And by helping them identifying their defenses, do you notice that when we're talking about what's happening in your body right now, you think of it as a somatic illness rather than something that's going on psychologically? Or do you notice that when we talk about this, you start to criticize yourself? Do you notice that? Yes, I notice that. I wonder why you do that. Could we try to figure out what happens in your feeling life, in your psychology when you do that? And also, what's the consequence of that? Is there a negative? Of course, you are able to avoid your feelings and don't feel the painful feelings and the anxiety by using the defenses. But do you also see that there is consequence of this? These three steps are essential for a patient to be able to turn on them. This is what Patricia would call helping the patient getting acquainted with their defenses. Being able to identify, seeing the function, and seeing the consequence or the cost of the defenses. Because when and only when the patient sees their defenses, have an understanding that they know what you're talking about. If you start making challenges, if you don't do this, if you don't do that, without their having an intellectual understanding that they're using, if they don't recognize that they're using a defense, that's a path, a highway into misalliance. So they have to see the defenses, they have to see that their defenses are hurting them, and they have to see the alternative to using the defense. In other words, they need to see their triangle of conflicts, and that the solution to this is to feel their feelings. And only then can they make an informed choice on whether to keep on using the defense or not. It's not until they really see these patterns, that they see their defense, they see their cost, they see the alternative, then you can have a co-therapist. You will get an agreement on the therapeutic task that I'm here to put away my defenses so I can feel my feelings. If you don't see your defenses and if you don't see that they hurt you, why on earth? It has to be a psychologist that would like to feel their feelings for no other reason than just feel our feelings. Mostly people are hesitant to feel their feelings because they are painful. They're conflictful. But they have to see that the reason why they avoid it, the way they avoid it is hurting them. First, then you can have an agreement on the therapeutic task on actually feeling the feelings. And then you can have your patient as a co-therapist. So that was my tiny didactics on the basics of ISTDP and on the basics of defense work. Anyone? Yeah, question, Anne.
Could you just say a few words about how you feed the inquiry into your thinking?
Yeah. It's interesting that I've chosen the case. I know why I've chosen the case I'm going to show, because there is cooperation on the defense work. That's the main point with this video. But I'm skipping a little bit the inquiry in this case. I would always start by asking the patient, what's the problem you would like me to help you with? And then I get the specifics. What kind of symptoms? In which kind of situations do you experience this? What's the typical triggering situations? What was the precipitating event before you first experienced this? Trying to get the details, the history of the symptoms, the severity of the symptoms. And already when you start doing this, the patient will start to give you a few hints. You start ending up maybe criticizing themselves if it's a depression problem, giving you some hints of what kind of defense mechanisms they probably will use. And I will try to point that out quite early. Is this something that you tend to do, that you criticize yourself? Or you say you have no clue, you don't have any understanding of this. Is this the way you usually talk to yourself? Is this... So starting to try to talk around what's creating the symptoms. And then I go for a specific example. This is Devon Lew's central dynamic sequence. I will go for a specific example, not with the aim of getting a breakthrough to feelings, but to start talking about how, trying to put the patient on the conflict of triangle, so that you both can see, okay, I ask for feelings, so that the patient can see that they're avoiding feelings or getting anxious for feelings, and the way they avoid their feelings will create their symptoms. That's the part of the inquiry. This was my presentation in Venice. No, not in Venice, in San Diego, about co-creating this. And this is, that's a different lecture for today, but it's starting to take the history, doing a couple of specific episodes, trying to put pressure on feelings, trying to help them differentiate the corners of the triangle, and also always keep the presenting problem in mind, so that you can say, do you think that this way of treating your feelings, criticizing yourself, taking the blame, is creating your problems? Could this be that this is some of the mechanisms leading you into this depression, for example? Or, like in the case we're going to see, where this young man has somatic symptoms of anxiety, and rather thinking that as a result of his feelings, he thinks that there's something wrong with his body. He thinks that he's somatically ill, that there is something wrong with his heart. which will create what we call health anxiety. Was that clarifying anything?
Yes, thank you.
Okay.
I think this is a corrective emotional experience too, Jon Anders, of what your heart was for today, for our community, right? And being able to have a place to talk and reflect and look at the differences and understand the roadmap that you know, have so beautifully laid out. And I just want to say to all of us that are still here, you know, how can we continue to support getting the good work that you have written out into the world through Amazon or reviews or passing along, you know, for those that teach and train or your own self to gift these for the holidays. I mean, just like how can we continue to spread the love of your precious book to the world?
I would be super pleased if you just talk about it, tell people about it when you've read it. And I would love to hear your feedback. It will be a second edition, I hope. So if there is something that lacks or is unclear, I would love to clear that up. So your feedback is invaluable. But if you can give a feedback on Amazon, that would be fantastic. Yeah,
Yeah.
spread the word.
And spread the word, spread the
Uh-huh.
love, and you will be offering a similar kind of 3 hour, you know, the same sort of thing with our Australian colleagues. So, Jon Anders, if you wanted to put the link in the chat, if you have it easily, or maybe you could just send out, just so that if there's colleagues of yours that aren't here today that could potentially, you know, make it for that one, let's just continue to, yeah, share you know that date and time
Yeah.
as well.
So that's next Wednesday,
Okay.
in the middle of the night in US, in the morning, 8
Oh,
o'clock
okay.
Central European time, uh, at 6 o'clock in Australia. I, everyone who has registered got a link to buy the book with a discount code.
Yeah.
There is also a link in, oh, Tammy froze.
Oh,
There's also a link in the chat to Routledge, but if you Google my name and Introduction to Intensive Short-Term Dynamic Psychotherapy, there will be, it's available through any bookstore, online bookstore. So,
yeah. Beautiful.
yeah. And I
Wow. Well,
I
thank
really hope
you.
to see you all in person in
Yes.
Croatia next October.
Yeah.
Uh, for those who haven't attended one of the IETDA conferences, I highly recommend it.
Yes. It's a way that we can like give each other a hug in person. Yeah. Well, I just want to say thank you all for your presence, your engagement, your questions. Thank you, Jon Anders, for this idea to all come together. It's just been a privilege to witness your work and to partner together with you in doing this. So,
I'm so
yeah.
glad that you joined me on this, Patricia. No, Patricia, Tammy. A slip of the tongue.
Patricia's loving energy is in the field as well, and I love that your mentor showed up. You know, she's such a dear with all of
Yeah,
her students.
yeah,
So,
yeah.
yeah.
Mm.
Okay, well, we want to
Okay.
honor everyone's time and
Yeah,
good night and good day, and yeah, look
yeah,
forward to more to come,
yeah.
Jon Anders, right? More to come.
More to come. See you all. Bye.